as a newspaper journalist, calls to cover hospital events and institutional programs flood in almost on a daily basis. But today, one message stood out. A WhatsApp note from a teacher from St. Mary's School in Kizhakkambalam caught my attention. Inside the school, the students had built a functional mock hospital, a complete hospital with outpatient, emergency, and even a pharmacy. Not just a demonstration, but an immersive, hands-on understanding of care and empathy. That was the moment I knew this was the story worth telling. St. Mary's School has recently been organizing some truly interesting programs, the kind that don't just check boxes, but actually leave a mark. I've had the chance to cover a few of them in the past, and I must say they were thoughtfully arranged and executed with a lot of heart. What we are seeing is a tiny tot receptionist of this multi-speciality mock hospital. The patients that we see have been waiting patiently for us to come so that they put up a good show when the state's leading daily Malayalam Manorama's representative comes to cover the event. First, we spot the outpatient doctor checking a patient, and then it's off to the ENT department when the nurse suddenly stops the students in their tracks.
Patient number 2, Miss Desiree, please come in. Good morning. What happened to you? Good morning. My ear is hurting a lot and I cannot hear properly. It started 2 days ago. The pain is getting worse now. Please sit in this chair and doctor will check your ears.
As you can see, the patient and the doctor are playing their parts really well.
I am Belgium. You will get the medicine from the pharmacy and you can go this way.
There's a long queue for seeing the ENT doctor. Next, we move on to orthopedics, where a doctor is seen attending to a young patient with a broken hand. Next, we move on to gynecology department, where a husband and wife are waiting to see the gynec doctor. We move on to pediatrics, where the patient really acts his age. Next, we move on to the general ward, where 3 patients are seen admitted, and the doctor and the nurse are on their rounds. The most interesting area was the operation theater. A setup so realistic, even the patient seemed convinced. But just as the student doctors leaned in with grave expressions and serious instruments, something unexpected happened. The girl lying on the table, playing the patient, suddenly burst out laughing. Why? A group of her classmates had quietly crept in to watch the proceedings, and their faces twisted in exaggerated worry. The sight of her friends looking more nervous than the doctors themselves cracked her up, and she simply couldn't hold it. It was that unscripted moment that I clicked. And that was Doctor's Day at St. Mary's, where future healers wore tiny white coats. Ailments were cured with crayons, and laughter was the best medicine. Here's to the spirit of curiosity, care, and creativity, straight from the classrooms of tomorrow's dreamers.
Take one medicine after lunch and one after dinner. Take up syrup 2 times a day, not always. Should I avoid any food during fever? Yeah, avoid oily and spicy food. Drink warm water and eat soft food like rice or soup.